Welcome our viewers to today's vlog, and Daktari today is going to tell us about blood transfusion. Karibu Daktari.
Eh, Asante sana watazamaji, karibu kwa hii channel, na leo tunaenda kuongelelea about blood transfusion, and this refers to a donor giving a recipient a blood. After a donor has donated that blood, we can transfer to the recipients, and this one is maybe due to anemia. Anemia is when your blood has a low hemoglobin levels, and these hemoglobin levels in the blood and red blood cells, they just transport oxygen and also nutrients to the whole of the body. And when you have anemia, low blood count, you find you have shortness of breath, tiredness, weakness, and those one are the symptoms that if a patient come to you, you at least you check on hemoglobin, the blood level. And to this, we see the conditions that may lead to blood transfusion. Patients come with low HB. You might think of severe infections like severe malaria. If you have malaria parasites which are above 2,000, you find that these parasites, they feed on blood, and also they make the HB to be low. And also there is a infection like sickle cell anemia. This reduces the hemoglobin to the red blood cells. So you find the patient has a low HB. You might think of hookworms. Hookworms are the worms that you feed when your hygiene is poor. Maybe you are not washing your hands, vegetables, green vegetables, and also fruits. So you get these hookworms, and they feed on the blood. So you might get iron deficiency anemia, and also when you have cancers, any cancer in the blood, you can get low HB, and when you are in chemotherapy. So before you are done any chemotherapy, you must be given a blood, because these chemicals, they kill the red blood cells. So you find your HB will go down. Bleeding disorders like bleeding internally, you might get those conditions that you might lead to bleeding. So you find your HB to be low, like upper GI, you might think of peptic ulcer disease. Lower GI, you might think of colon cancer, hemorrhoids. Those ones, they lead to low HB. So you might require for transfusions. And also obstetric bleeding disorders like uterine fibroids, you might lead to low HB. And also there is so many conditions that may lead to someone to be transfused. And somebody's being transfused, you transfuse this patient to maybe blood cells. You want these patients to get more hemoglobin, so you will transfuse the whole blood cells. You want to transfuse this patient so that you can get platelets, so you can also transfuse a patient to get more platelets, clotting factors. You want to get plasma and a higher volume to these patients, you can also transfuse. So you transfuse to maybe red blood cells, and also liquid, which is the plasma. And before we transfuse these patients, or the donor must go to so many tests just to rule out any conditions that you don't want our recipients, the person who is going to receive this blood, not to get more problems. Because transfusing blood, it is just saving of life. You want to increase these patients to get more life. So your donor, the person who donates blood, must go a serious test that to qualify for this blood to be given someone. So you must be done a test like HIV test, which is PITC. Your blood must not get this, must not have this virus. You must do hepatitis B, hepatitis C, so that this patient may not get this virus. Also, STIs like transmitted sexually, maybe diseases like STIs, gonorrhea, syphilis. So your blood must be screened for these infections. And also you must be done. You must do GMX, so that you must cross the donor and the recipients these bloods too, so that they can match. So so transfusing these patients, your recipients must be done also tests like you must nurse must monitor the vitals. That's when we talk of blood pressure. You must check on the pulse rate, respiratory rate, the temperatures, so that you can identify if your recipient is receiving maybe reaction from the blood. So you get this routine monitoring after, let us say, regular. After every 30 minutes, you must take your recipient's client every time, so that you can monitor these reactions. For any reaction, you must stop this blood, and also you stop the blood, and you manage on the reaction, and you take the blood to the lab for any you be done the examination of the blood. So this your recipients must have an IV line that is going to be transfused first. The patent, you must get a patent IV line, that you don't do this your blood to maybe to clot, you want the blood to run for so long. So for a one pile, it must cover 4 hours. 4 hours, and you monitor these patients very closely for any reaction, because we don't want the patients to get more side effects than the benefits from the blood. So you ask the patients, how are they feeling? Are they feeling cold? Are they feeling fresh? Like those are the questions you ask these patients for any side effects. So for only 1 pint of a blood, it may be increased to 1 grams per deciliter. So if the patients need more, you give more for any for for the benefits of these patients, to receive the maximum of the blood that you want to these patients. For iron deficiency, it is not for all the patients need this transfusion. You must ask the patients, are they willing to receive the blood? If they're not, why? Have you taken a good proper history? It might be culture, they don't need to transfuse. The culture, the religion. So you can't force the patient to receive a blood. You must ask first, are they willing to receive the blood? If not, why? And you counsel them. You counsel them on the benefits of transfusing this blood. So not everybody that comes with an OHP need transfusion. You must ask them if they're willing to receive this blood. So for iron deficiency anemia, not everybody you transfuse. You must check iron deficiency anemia. Are they lacking ions? If they are lacking ions, are you supposed to transfuse or give the drugs that boost this your patient? So your full hemogram which is the best indicator there to know if your patient is receiving this blood. So you must identify this one from a full hemogram. So thank you very much for watching this interview, and I hope you are going to meet in another section. And please, if you are watching this video for the first time, please comment, subscribe, and let's move forward. Thank you.